Well, I've been joined by Vice President of the Society of Cardiology, Dr. Francis Ejekum, for a conversation on the fact that lifestyle and lack of exercises is a leading cause of stroke in young persons these days. Grateful for your time, Doc. First, let's break it down. What kind of lifestyles are leading to these cardiovascular diseases? Hello, Doc. Well, we just lost Dr. Francis Ejekum there. He is a vice president of the Society of Cardiology. He will be talking to us more about the reason why lack of exercise and unhealthy lifestyles are leading causes of stroke from young people who are reporting at our health facilities these days. Well, before we do that conversation, let's listen from a few of you we spoke to on the streets of Accra.
A normal exercise, one of the station, from 5 a.m. to 5:30. I normal that's my exercise, join them, and Saturdays I go jogging. I don't take pizza, those food I don't take, because where me myself I brought up from, we don't take those things. So I take my normal bangkun and plantain, cocoyam, yam, all those things. That's what I normally take.
When I wake up in the morning, I don't actually take those light foods in the morning. I just take something like rice, benku, and those stuff. It's not like breakfast in the morning, yeah. Those benku and those stuff, yeah, heavy food. So it take you up to, I think, the middle of the day, then you get something like gari soakings or those stuffs to eat, yeah. Okay, so I think in the evening, mostly we eat fufu. Yeah, that's all for the day.
Normally, instead of 3 times, sometimes I eat twice a day. In the morning, I make sure that I take something heavy, like 9 o'clock going, like maybe beans and gari or kenke, so that it can sustain me well. Because if I take tea and cocoa, within a short time, I'll get hungry.
Because of my work schedule, I don't have time for the gym. But my daily routine, like walking, house chores, is also an exercise for me.
I can't remember the time I actually went for a general checkup. I used to go to the gym also, but then for some reasons I couldn't stop. I couldn't go. I stopped. Yeah.
Well, Dr. Francis Ejekum has joined us back. He's the Vice President of the Society of Cardiology of Ghana. Grateful for your time. I wanted a breakdown of what really we're talking about. Lifestyles. What kind of unhealthy lifestyles are leading to these cardiovascular diseases, Doc?
All right. Thank you. Good morning once again. So when we talk about lifestyle problems or lifestyle, they are the behavioral risk factors that can lead to cardiovascular disease, the way we eat. So unhealthy eating habits, people eating the wrong things, fatty foods, deep fried foods, and so forth. People eating late in the night, not getting enough time to use the food before they go to bed. All these lead to problems for us. Then smoking is also another problem. Unhealthy lifestyle, then exercise, like lack of exercise. There are a lot of us who don't like exercising. We sit in our cars, we go back to the home and we sit behind television. So all these are problems that lead to the intermediate risk factors. These intermediate risk factors are hypertension, diabetes, cholesterol problems, obesity, but they generally result from our lifestyle and eventually lead to the cardiovascular diseases, most commonly stroke and heart attack.
Well, you say mostly young people are the ones reporting to the health facilities with these diseases. Let's look at the age range. I mean, the people who are reporting with these cases.
We have seen, if you compare Ghana to the other countries, if you go to US and UK, you tend to, these people presenting with these diseases tend to be in their 70s and 80s. But in Ghana, we are seeing quite a number of people in the productive age group, 40 years, between 40 years and 60 years, and indeed, quite a number of them below 40 years. My youngest patient who came with heart attack was at 27 years, and this is too early for people to be presenting with heart attack. That is also one of the reasons why, as a society, we are getting worried and need to educate people about it.
Well, the other problem is that, I mean, everything comes at a cost. Eating healthy, for example, you need about 50 cedis to 200 cedis to get a healthy meal. How many young people can afford that? Again, the simple exercises we're even talking about, that's even if you don't have to go to the gym, you definitely have to sacrifice either to work early to be able to at least get some exercise, or sacrifice your sleep to get exercise and still report at work early. How do we balance this? I mean, it's quite difficult, though.
It is, but, you know, when you see health as an asset, then whatever you need to do to protect your health is important. A number of them have cars. You take your car to the mechanic. Even when the car doesn't have a problem, you go and do servicing. So what we are saying, and that was about 5 years ago, we started preaching this: incorporate physical activity into your daily habits. When you wake up in the morning, you go to wash your car or do something, you can't do it yourself. When you get to your workplace, if your office is on the 4th floor or 3rd floor, instead of taking the lift, you could walk the stairs. During the lunchtime, instead of sending somebody to go and buy you food, you could walk there yourself. So you try to incorporate these activities into your lifestyle. You don't need to go and pay money in a gym before you can exercise. If your house is, big enough, you can also exercise there. And all these are very good activities. When it comes to the diet, sometimes you even find that some of these junk foods are more expensive than when you take time to prepare your food. If you have a backyard, you can prepare some of these vegetables and things there and harvest them for yourself. So I think taking active steps for your health is something we all need to learn and do.
Your society is on a sensitization drive to help deal with this challenge. What's the plan?
So the plan is, we started about 5 years ago and we are keeping to that. This year we are going to do more education. We need the media to also be involved in this so that when we say it is you, the media, who can propagate the message. Last year we had a screening program for about 5 different places in Ghana. This year we will continue with that to screen people, because part of the prevention is also to detect them early. So as we educate people to eat healthy, those who already have it, we detect it early and be able to manage them well. So this is something we are going to do. In May, it's the May hypertension month, May measurement month. We are going to be doing some screening for people, detect it early and help them to manage it well.
The Electoral Commission will be talking about the Electoral Commission shortly. But Dr. Francis Abuaje, I'm grateful for your time, and the advice is for people to live healthy lives, eat healthy foods, and actually take good care of themselves by also exercising. Thank you so much. Francis Abuaje is the Vice President of the Ghana Society of Cardiology. Now let's